Hello, I'm Dr. Feast Price, and I will be providing the lectures for this course, Group and Family Therapy. I'd like to begin this lecture series by telling you a little bit about who I am, which gives you a context by which to understand some of the things that I'll be saying in the course. I've been on faculty here at the University of Kentucky in the graduate program in rehabilitation counseling since 1992. I teach the courses Theories and Techniques of Counseling 2. I teach group and family therapy. I also teach mental health treatment and diagnosis. Previously, I taught medical and psychosocial aspects of disabilities, where I taught those courses for 12 years. And I also enjoy teaching the field placement courses, both internship and practicum. As it relates to my expertise and experience in group and family therapy, as well as counseling in general, I have my certification as a rehabilitation counselor, and I've been certified since 1989. I'm a licensed professional clinical counselor here in the state of Kentucky, where I've been licensed since 1992. Prior to having my license here in Kentucky, I was licensed in the state of Louisiana, which was in 1988. I'm also a licensed psychologist in the state of Kentucky, and I received this credential in December of 2011. I have a PhD in counseling psychology that I received in 2006. However, prior to that, I received a doctoral degree in rehabilitation, administration, and education. I received that degree in 1992. I finished a master's degree. It was a master's in counseling psychology in 1990 from Southern University in Louisiana. So I am a native Louisianian, so if you detect a slight accent, it's because I'm from Southwest Louisiana, where we speak with a little bit of an accent. So I look forward to sharing my knowledge and expertise with you over these 8 lectures, and I hope that you find this a very thought-provoking and knowledgeable experience. So what I will be doing for this first week of lectures is giving you a context by which to understand the history of group counseling. I will also provide an overview of group counseling. In addition to that, I'd like to talk about the group counselor in general and give you a context by which to understand the role and function of a group counselor or therapist. And also for this week, I'd like to share information about ethical and legal issues in group counseling. This is an 8-week course, and what I typically do both with my on-campus students and what I will be doing here is, for the first part of the course, I'll give you a knowledge base specific to group counseling. And then for the latter 4 weeks of this course, I will give more of a broader understanding of family therapy. I find that the course is best understood when we break it into the group counseling aspect of it and then the family therapy aspect for the second portion of the course. So with that in mind, what I have described to you previously is what will be provided in the first lecture, which is for week 1 and is specific to group therapy. So as I mentioned a little bit ago, I'd like to start off by giving you an overview of group counseling, as well as the history. I always think it's important that you understand the genesis of the information that's being taught, because it's really the genesis that shapes how the profession was initiated, as well as how it evolved over time. And so that's the direction that I'd like to go for our very first lecture for this course. So the first question one might have is, what exactly is group therapy? And so group therapy is a form of psychotherapy in which a small, carefully selected group of individuals meet regularly with a therapist. And so one of the things that's really important that is emphasized in the definition is that group therapy is a carefully selected group of individuals for the group process, so that what it says is that it's important to understand who the participants are, why they're coming, and to make sure that it is a good fit. You want to make sure that there's a good fit, not only in terms of the purpose of the group, but also the persons that are a part of the group process. Group therapy also occurs with small groups. When groups are too large, then it isn't therapeutic. It might be informational, but the therapeutic nature of the group is believed to be lost when it is too large. And so basically the core elements of groups are that, number one, the members are carefully selected around a particular topic, and the groups are small, and the participants meet on a regular basis, and there is a therapist that serves as the leader or facilitator of the group process. The purpose of group therapy is to assist each individual member in emotional growth and personal problem solving. One of the beauties of group therapy is that persons in the group learned from the wisdom of each other. And so not only is the group, the therapist essential in the growth process, but also other group members are a very essential part of the group process, because I find that all the work and the growth and the problem solving that each member gets isn't only from the benefit of the therapist, but also from each other. And we all bring certain knowledge base as well as experiences to the therapeutic context. And it works best when we're able to share with each other, because my way of looking at things might be slightly different from that of other members. And so also members in the group have a shared experience. So they share their knowledge base, their life experiences, they challenge, encourage, and motivate each other. And I think that one of the benefits of group therapy is that you have the wisdom and expertise of the members in addition to the therapist, whereas in individual therapy you have the luxury of only the individual therapist. Of course, you have you are the primary focus of the therapist for typically 50 to 60 minutes. However, you have the perspective of the one therapist rather than the multiple perspectives that often exist in a group therapeutic context. As a description, group therapy encompasses many different kinds of groups. So they might range in spectrum from an eating disorder group, a PTSD group, a bereavement group, you name it. It could be around all sorts of issues or concerns that the participants share and enter into the group process for. And so there are different kinds of groups. There are varying theoretical orientations that also exist for the purpose of groups. And so one of the things that I'll be talking with you about in this course is the different kinds of groups, as well as some of the theoretical orientations that are most often used in a group context. All group therapy groups exist to help individuals grow emotionally, as well as to develop effective problem-solving skills. When I have met with persons in a group therapy context, it's typically because they are stuck as it relates to emotional kinds of issues. It might be other kinds of issues that include substance abuse, eating disorders, various life circumstances. But the group process is to help persons to grow emotionally, to help them move from where they are when they first enter into the therapeutic relationship to a better place of self-actualization. Always the core area is helping persons within the group to develop problem-solving skills, recognizing the problems, ways in which they have functioned in the past, and helping them to develop new and refined problem-solving skills. Also, all groups utilize the power of the group. Each individual member in the group context is essential for helping the members in the group to grow emotionally as well as personally. And so the therapist serves as a leader in the process, but the power of the group is really the group members themselves. But what is also important is that the group leader is skilled in being able to move the participants through the group process, as well as safeguard group members from problematic behavior, because those things can occur and develop in a group, which can be detrimental to members of the group. And so the leader must be very skilled and aware to avoid some of the pitfalls that we'll be talking about later on that exist in the group context. So I'd like for us just to kind of understand the history of group therapy. And what I'd like to do is focus on group in the United States. If you look at the literature itself, group therapy has been etched in service provisions, not only in this country, but in other countries as well. So group therapy does have a global aspect to it. But for the purpose of this course, I'd like for us to focus on the history of group therapy within the United States. And it can be traced back to the late 19th century as well as the early 20th century, when millions of immigrants moved to the United States, or to, at that time, the Americas. And organizations were founded to assist immigrants in their adjustment process. What was established, and in some instances out of grassroots concerns, were people that had shared issues, concerns, and values, that felt that their needs were not being addressed. They came together, they discussed those issues, and they identified ways of impacting change within their communities. So it really started from a really grassroots level with just immigrants who had concerns about things that were needed in the places where they were living that wasn't being provided. An example is there were some of the areas that were established for immigrants where some of the parents felt that there were no places, safe places for children to play, for children to enjoy being outside. And so among the issues that were brought about by the immigrants, one had to do with making sure that children had safe places and spaces where they could play outside and have not only exercise, but meaningful play activity. And so through these movements, immigrants made sure that their needs were being met and were not neglected. So that was the very beginning of the group process, which occurred in the late 19th century. The therapeutic part of groups is that whenever persons of similar concerns or backgrounds or issues come together and share from each other, there's a sense of shared values, shared concerns, and kindred spirits that exist. And so whatever you're going through, if there's someone else that's going through similar kinds of issues, whatever the problems are become far more bearable. And so in addition to the emotional release that these immigrants felt as a part of their sharing with each other, they also identified ways of problem solving and impacting in a positive way some of the problems that exist within their community. There were also agencies that were promoted for lobbying for better living conditions. So first they came together, they identified what their problems were, some of the concerns, their frustrations, and then as a result of their shared experiences, agencies were developed to promote lobbying for better living conditions. So not only was it an emotional aspect of these groups, but also the problems were recognized and solutions were identified. So again, it's the emotional aspect as well as problem solving that is a very integral part of the group therapy process. So it's important to recognize that in the group therapy process, valued were group participation, a democratic process where everybody had an opportunity to express their thoughts, feelings, issues, and concerns, and personal growth was a direct result of it. So it's group participation. It's not a process by which persons are told what to do. It's a shared collective experience where all members are equally engaged and involved. They share their thoughts, feelings, and concerns. Everyone is heard, and everyone grows personally as a result of the group process. It was in the early 1900s, in fact 1905, when a medical doctor named Joseph Pratt formed groups for impoverished patients who were suffering from tuberculosis. And what he found is that as a result of putting his patients that had TB in these small groups, there was bonding, there was that shared experience, there was the exchange of information, of issues, feelings, and concerns that was very liberating for patients with TB. And it was found that persons got better as a result of this group experience. And even when the symptoms did not change, their mental health changed. Their way of feeling and experiencing their circumstances were different. And as we all know, the mind and the body are connected. And so mentally, if you're feeling better, it does have a positive impact on your physical health. Or vice versa, your physical well-being can impact your mental health as well. And so Dr. Joseph Pratt recognized that when he put his patients in these small groups, all of which that had TB, but they were brought together by certain characteristics that were similar. For example, age, it could have been ethnic group as well as gender. He found that persons' suffering changed, that their outlook was more positive, and their living circumstances changed significantly. So Pratt believed that patients could provide mutual support and assistance to each other, and as a result of the support and assistance, their symptoms sometimes improved, and even if the symptoms did not improve, their mental state definitely was far more improved. Alfred Adler is another person within the United States that significantly impacted group therapy and played a significant role in the history. And so Alfred Adler believed that many individual problems were social in origin. And so he said in order to understand the problems that persons presented with, you had to understand them from a social context. And it's really true if you think about who you are and some of the issues that you might be faced with, because we all have issues and struggles. And so when you look at those, they're not in isolation. Usually they're connected with other individuals, with collective settings. And so it was Alfred Adler back in the 1930s that encouraged his patients to meet in groups to provide mutual support, to share some of their issues and their concerns. Patients found that others had similar concerns, coped with issues differently, and so they learned from the wisdom of each other. And so it was during this time, back in the late 1930s, that social work groups began forming, and these groups began to form in mental hospitals and child guidance clinics and prisons, as well as in public assistance agencies, because it was recognized that when persons who shared similar life experiences, that had similar things in common, that collective experience serve to positively impact the emotional well-being, as well as persons were able to develop problem-solving strategies that superseded what they had typically been doing. They learned from the wisdom of each other. So it became not only a movement among patients, but also within the ways in which services were provided in social work groups, as well as in various kinds of treatment settings. So support groups are a contemporary descendant of some of these earlier groups. Nowadays, you find more therapeutic treatment groups, more psychotherapy groups, where persons are required to have an advanced level of education and understanding about certain kinds of mental conditions, different kinds of axes conditions, be it axis 1 conditions with schizophrenia and other kinds of mental illnesses, or axis 2 kinds of issues with personality disorders, for example, bipolar disorder. So with some of the more axis 1, axis 2 kinds of issues, it's found that therapists must have more advanced forms of treatment expertise, and so they have to have a expansive knowledge base by which to understand the presenting issues and providing treatment. But that kind of treatment came a little later on, but in earlier times it was more of the support group kinds of treatment that was made available. And the support groups are more of a contemporary descendant of the earlier groups. Whereas people with a common problem came together, they functioned without a leader or a therapist, members helped each other solve common problems, and it's consistent with some of the Alcoholic Anonymous, Narcotic Anonymous kinds of groups that exist within our environments today. They may also be persons that might have adjusting to a traumatic brain injury, a grief or loss groups, bereavement groups, where the leaders are the peers. And so these are more of the support groups that are descendants from earlier years. However, along with those support group kinds of treatments, the profession has evolved to provide more knowledge-based, didactic, goal-directed treatment therapy groups for different kinds of populations. So basically, that brings to an ending the genesis and overview of the history of group therapy. I hope that it provides you with a broader context by which to understand how treatment groups came into existence within the United States, how they have evolved over time, and what I will do is expand your knowledge base to discuss and describe how treatment groups currently function within the United States, as well as some of the different kinds of treatment groups. But I wanted to, with this brief presentation or overview, is to provide you with an understanding by which to understand how group therapy evolved over time, what was some of the fundamental kinds of issues that caused groups to become relevant. And as you can see, they began from very grassroots kinds of experiences from doctors as well as other kinds of professionals, realizing that when persons come together with a shared experience, they grow personally, they gain from wisdom, as well as expanding ways of dealing with and resolving some of their problems associated with whatever they're going through. So what I'd like to do is end here, but then I will continue our lecture by sharing information about the counselor, the group counselor, to expand your knowledge base on how the group counselor functions, what are some of the key elements to the group counseling context. And so that's the next lecture, which is considered your lecture 1B. Thank you for your attention.